I've had people reach out to me who want their son or daughter or husband or wife or partner to try ketamine therapy. And what's really interesting is that when someone really doesn't want to try ketamine therapy and we try to influence them and persuade them and coerce them into trying it, it's not really effective. There has to be an initial deep desire for the individual receiving ketamine therapy to maximize those benefits from the treatment. So one of the things is that if you've personally gotten a lot of benefits from ketamine therapy, don't really try to persuade or push people to do ketamine treatments because it's really not for everyone. Some people are just called towards doing it. They're curious about it. They think it's going to make an impact. They're personally motivated internally to try ketamine therapy. But when it's coming from an external influence, it's just not as profound. One example of this, I have a 2-year-old daughter. She's amazing. But when we try to force her to do something that she really doesn't want to do, she gives us a hard no. Similarly, even as adults, sometimes when people try to persuade us and influence us, we just want to say no. So when you're trying to persuade or influence someone, just don't do that. Let it be. One of the things that you can do, though, is inform them, educate them, maybe share your story. Also, be the best example of you that you can be. So it makes people curious, like, wow, what is that person doing? What's inspiring them to work out? What's inspiring them to start meditating? What's inspiring them to start therapy? So that they can ask you why you're doing it. And then you can share with them your story and your experience. But when you're trying to influence and persuade and coerce, it doesn't really lead to a lot of success. And there have been times when patients have come reluctantly based upon their spouse really persuading them and pushing them and kind of saying, hey, you should try this. And they do give it a try. Maybe they'll do 1 or 2 sessions. What I've personally noticed is that they don't really get a lot of the benefits. Their depression scores or their PTSD or anxiety numbers really don't make an impact. So bottom line, be the best version that you can be if you've personally benefited from ketamine therapy, and have people come to you and ask what's going on, rather than you being an evangelical or trying to persuade all the people around you. Because it's not for everyone, and if they are inspired to do it, they will come to you. Please let me know what you think about this. Leave me any questions, comments below. Hit that like and subscribe button so you can stay up to date on the latest ketamine information, and I'll see you on the next video. Take care.